Physical therapy is so important. I think almost regardless of what pelvic condition they have, whether this is, painful sex, pelvic floor muscle dysfunction, interstitial cystitis, or painful bladder syndrome. So regardless of what type of pelvic pathology the patient has, almost always physical therapy helps to a certain degree, pelvic physical therapy. And this can be whether it's internal work, external work, breathing exercises, lifestyle modifications in terms of like hydration, fiber intake, nutrition, and whatnot, sleep. But either way, at least the pelvic floor physical therapists that we work with are awesome, and they play a huge role. So I feel like even if patients are hesitant to try medications, hesitant to try injections, interventions, whatever it may be, pelvic PT is a good place to start that's non-interventional, non-medication, and can help to a certain degree, because oftentimes in the pelvic floor, there are many sort of factors that can play a role, whether it's muscles, bone, tissue, nerves. And oftentimes, even if a nerve is inflamed, the muscles will by default be irritated. And pelvic floor PT can help to a certain degree with some part of the pelvic pain. So if you're hesitant to seek out medications or interventions, try pelvic PT, and it's a great place to start. There are some excellent pelvic physical therapists out there, and I think it's great for everyone, and especially for pregnancy and postpartum. I think it's a game changer, and I can go on and on about that in terms of pelvic floor dysfunction. But if you have pelvic pain, if you have sexual pain, it is a good place to start.